take the deaths and divide it by the number of cases, and you're going to have a percentage, and that's going to be the death rate. All right. Well, when it was first developing 10 days ago, 2 weeks ago, it was hovering between 1 and 2. Now it's jumped up to 3. It could possibly jump up to 4 and 5. All right. What would be extremely disconcerting and concerning is if the death rate pops up to between 7 and 10%. Now, that is where it gets dangerous. Like over there in Italy and Spain, they have high death rates. I think they're right at around 9 and 10% right about now. Okay, so this is why social distancing and just proper and using common sense and general hygiene is so important right now. I know a lot of, if I happen to have some wise young people looking, because I know even though the world is going to hell in a handbasket, it seems, remember that, it seems, teenagers and young adults, all they care about are their own needs, and they're not kind of worried about the coronavirus, when they need to be most concerned, because a third of the cases that are hospitalized are young people. First, when they talked about this pandemic, they said it was affecting mostly the elderly in terms of serious complications. All right, but now they have broadened that definition now, that it's getting to be a little more universal. So we all need to be concerned. Young folks, toddlers, infants, elderly, okay, and everybody in between. Nobody's immune. Remember, this pandemic is the invisible empire. It's the invisible empire, which means we cannot see the coronavirus or COVID-19. I'll just say COVID because, you know, I like to keep it real and make it plain with you. We cannot see it around us, okay? And we think, you know, I mean, for those of you, I know if you have, unless you've had your head in the sand for the last 3-4 weeks, everybody's heard about the coronavirus, COVID-19, and some of the manifestations and so forth. But those are the manifestations. What has bothered Dr. Jackson is not everybody that, well, you know, there's going to be people who are what we call carriers or vectors. And a lot of times they're thinking young people are the ones that can be the carriers or vectors because their immune systems may be strong enough to not show the manifestations of the disease or virus, but they're still contagious, which means they can easily transfer it to other people. And probably if they're not coughing or sneezing, then that means they're putting hand to mouth and so forth, and they're touching a lot of surfaces that we all touch, like door handles, doors, pens, remote controls, phones, and so forth. So remember, this virus, a lot of its transmissibility can be from not just people who have the symptoms. I'm going to pause for that because I need y'all to really, really think about that real hard. It's an invisible empire. You don't know who has it, and you don't know who's carrying it and who's contagious. We can all look so normal, but we can be full of that coronavirus. We can be full of COVID. So I need y'all to keep that in mind.